at the risks that come with it.
Joining us now is Dr. Mickey Kaplan. He's the co-medical director of the Chicagoland Children's Health Alliance. Hi, doctor. Thanks for joining us.
Hi, thanks for having me.
Lots of talk about reopening. We're moving forward. The big announcement today in Illinois is that Illinois schools are set to reopen in the fall with guidelines. What's the key to keeping the schools safe?
Well, I think the state's been very responsible in making these decisions, and I think we have to use appropriate guidelines like masks and social distancing and hand washing and limiting the school sizes and limiting how close kids are getting. But I think that, we are impressed with what the state has been doing, and with appropriate caution, I think we could do that safely.
Well, Dr. Kaplan, we know since the beginning of this pandemic that they had been predicting another surge, probably in the fall, and that's about the time kids are starting to get into full swing of school. Will we see that, and do you think they may have to pull that back and we'll be quarantined once again?
Well, we're all very concerned about the fall because that's when the flu virus comes, and it's going to be very difficult because when kids are getting back into an environment where they're near other kids, we're going to see lots of people with respiratory symptoms. And the state will be watching very carefully, looking at infection rates and hospitalization rates and allowing us to make changes. And we might have to pull back if we get a second bump that's quite significant. But I think that's built into the guidelines, and the IDPH will be watching that quite carefully.
States like Florida and Texas are reporting an increase in cases among younger people in their 20s, 30s, and 40s. What do we have to do to get young people to take this seriously?
Well, I think we have to use common sense, and I don't think the young people are always using common sense. Get-togethers with 50, 70, 100 people that are getting together at parties without social distancing and without wearing masks is probably not a good idea. Thankfully, most of the younger people aren't getting quite as sick, but some of them are, as you mentioned. We're seeing them in some of our hospitals, although the ones that have comorbidities such as obesity or diabetes, I think, have to be extra special careful in this situation.
Is it realistic to think that we may see a vaccine this year?
I think that's a little optimistic, frankly. I think given what I've learned in the last several weeks, it looks like vaccines are coming, but to have appropriate quality control and evaluation of these things, I think it's reasonable to think sometime in 2021 we'll have something that might be useful for all of our communities.
Dr. Fauci said today that hospitals have become more skilled in treating COVID-19 patients. Are you seeing that? Are hospitals doing a better job since back in March?
Absolutely. I think we're learning quite a bit over the last few months, so lots of various techniques in terms of how we provide non-invasive ventilation, how we might give remdesivir or even convalescent plasma. All of these approaches seem to be reducing the mortality rates, and so I think most of our systems are seeing reduced mortality, and thankfully, at least in Illinois, we're seeing a marked reduction in numbers of hospitalizations in the last really just couple weeks. So I think that's the most encouraging thing I've seen in the last 3 months.
All right, Dr. Kaplan, thank you very much. Co-medical director of the Chicagoland Children's Health Alliance. Be safe, be well.
Thank you, you too.